हाय नमस्कार डियर स्टूडेंट्स। अभी जो हम ये लेक्चर सीरीज कंटिन्यूअसली वी आर डूइंग दैट्स द एंटी हाइपरटेंसिव मेडिकेशन एंड टुडे वी आर गोइंग टू focus and discuss about the alpha blockers. Why alpha blockers are very important for your exam point of view? Because that use for two different kind of disease conditions. One is the BPH, hypertension and pheochromocytoma. So these medications are used for these various different disease conditions, and that's why this medication is considered as the most important for your learning point of view. Okay, so let's we jump into alpha blocker medication related detailed discussions, and that can add more value in your learning journey. Okay, so the first of all we are going to divide alpha blockers into two different groups. One is the selective. Okay, so first we have to break down the alpha blockers, break down into non-selective and selective. So alpha blockers can be divided into non-selective and selective. When the non-selectives divide further into two groups, one is irreversible and computative, matlab reversible. Okay, so don't confuse with this terminology, this can add your clarity. Okay, so non-selective alpha blockers. So before we start discussing further, we have to understand the distribution of alpha receptors. Okay, alpha receptors we can consider in this way. This is a pre-synaptic area and this is a post-synaptic area. Okay, so this alpha receptor and here is also alpha receptors. This is alpha 1, this is alpha 2. Okay, so for example this noradrenaline is bind to this receptor and this noradrenaline is bind to this receptor. If this noradrenaline bind to alpha 1 receptor, that can cause a vasoconstriction and that increase the blood pressure. This noradrenaline bind to alpha 2 receptor and that cause the negative feedback mechanism and stop releasing noradrenaline. So this is different mechanism, this is different mechanism. You have to understand this physiology very well. That can add significant positive learning process. Okay, so Phenoxybenzamine and Phentolamine. Majority of the time they are asking very simple questions. Phenoxybenzamine or Phentolamine comes under which of the following category of the medications? They are giving you few options and you should have to understand this comes under non-selective alpha blockers. Non-selective alpha blockers. Mode of action, this block alpha 1 and alpha 2. Okay, non-selective means it's not a selective. Prazosin is considered as a selective alpha 1 blocker, but this phenoxybenzamine and phentolamine is a non-selective that block the alpha 1 as well as block the alpha 2 receptors. Okay, and inhibit the effect of adrenaline and noradrenaline. Perfect. This vasodilation effect of this phenoxybenzamine or phentolamine is due to alpha 1 blocking. When this medication is block alpha 1, what that can cause? That can cause a vasodilation. This is the vasodilation and this is because of the post-synaptic. This is a synapse. So this is the post-synaptic alpha 1 blocker. Okay. The presynaptic. This is a synapse. So this is considered as a presynaptic. So this is the presynaptic receptor alpha 2. Okay. So if they block alpha 2 receptors, try to understand, they block alpha 2 receptor, what happened? This blocking alpha 2 receptor that increase noradrenaline release. And this noradrenaline is due to beta 1 receptor that increase the cardiac function, that increase the cardiac output. That is called the reflex to this, that called the tachycardia. Okay, so presynaptic alpha 2 receptor blockage increase noradrenaline release, and due to that enhance the tachycardia. Perfect. This is very interesting. Okay. So phenoxybenzamine and phentolamine has a two different kind of action. One is a vasodilation and second is alpha 2 mediated increase the cardiac output and tachycardia. Perfect. Indication, this medication used for pheochromocytoma. What is pheochromocytoma? That is an adrenal gland carcinoma that increase the catecholamine, like adrenaline release is significantly increased because of this cancer. This contraindication, when we are giving this medication that significantly reduce the blood pressure. The significant reduction of the blood pressure in certain conditions like stroke and coronary artery disease, significant blood pressure reduction is not advisable. That's why we should have to avoid such kind of medications in this disease states. Specific consideration, when the patient is suffering from heart failure, okay, in heart failure patients, the reflex tachycardia can disturb the cardiac normal functionality. Renal impairment, the excessive hypotension is also reduce the renal blood flow, and that can impair the renal impairment. Okay, because the vasodilation that's hold the more fluid in the peripheral system, and due to that the renal hypovolemic situation create, and that can cause the renal impairment. Breastfeeding, it's okay. Adverse effect, orthostatic blood pressure, okay, desire orthostatic BP drop in pheochromocytoma, vasodilatory effect that can cause the postal hypotension. Second part, common side effects, okay, common side effects, orthostatic hypotension, that is very obvious, orthostatic hypotension due to vasodilatory effect. Second, reflect tachycardia due to higher release of noradrenaline, and also vasodilation can also cause the reflective tachycardia. These are the two most important points. Third is dizziness and drowsiness and fatigue. This is because of the blood pressure change. Nasal congestion. This is also due to vasodilation. Okay, so nostril blood vessels get dilated, and due to that the patient might feel the nasal congestion. Infrequent side effects, meiosis, inhibition of ejaculation. This ejaculation, erection and ejaculation. Erection, especially in the male, that is because of, erection is because of parasympathetic and ejaculation is mainly because of the sympathetic. So due to the sympathetic disturbance might be the inhibition of the ejaculation. That kind of problem might experience by the patient, those who are taking this medication. Okay, GI irritation, confusion, headache, urinary urgency and dry mouth. This kind of problems are associated with urinary urgency because your prostate neck is getting more relaxed, and that's why the patient get more urge for urination. Okay, so side effects are also very logical and is pretty much understandable. Comparative information, phenoxybenzamine is irreversible alpha blockers and phentolamine is competitive, matlab that is reversible alpha blockers. This is a long acting 3 to 4 days phenoxybenzamine and is used for oral use, preoperative, okay, preoperative BP stabilization that's used, and this is injectable use in intraoperative during the operation, during the surgery. Blood pressure control can be achieved with the phentolamine. This unique user case also you can expect questions in your examination, so you should have to get the better understanding. Used primarily for the pheochromocytoma to counteract the excessive catecholamine. This is very important point. Often combined with beta blockers to manage tachycardia. Okay, vasodilatory effect is achieved through the alpha 1 receptor. Then the alpha 2 blocking increase the noradrenaline level, and due to that is causing the tachycardia. This tachycardia and other effect of noradrenaline can be controlled with help of beta blockers. That's why the pheochromocytoma patients, those who are taking a non-selective alpha blockers, always combined with the beta blockers to minimize these side effects. That's why you are getting questions in your exam. Patient is taking a non-selective alpha blockers. Why beta blockers are combining in pheochromocytoma patients? So you should have a good understanding about why this combination is given. Perfect. Okay, now let's come to the selective alpha blockers. Okay, when we are talking about the selective alpha blockers, name prazosin, tamsulosin and terazosin. Zosin is a very common word you can remember. Block alpha 1 receptor. This is a specific medication that block the alpha 1 receptor. Okay, that's a post-synaptic alpha 1 receptor blocking. Artery and venous venodilations. Okay, so broadly that's a blood vessel dilation. That is the most common effect. Little effect on alpha 2 receptor. That's why that causes less reflect tachycardia. Tachycardia is main problem with the non-selective. Here in selective they have a more specificity towards the alpha 1 receptor. And also non-vascular smooth muscles like a bladder neck. Some of the specific affinity towards the alpha 1 receptor of the bladder neck, they have a specificity like tamsulosin and terazosin. They are more specific for the bladder neck. And that's why these medications have a primary use in BPH, benign prostate hypertrophy. Okay, and urinary resistance can be minimized with such kind of medications. Indications, hypertension and BPH. These are the two different disease conditions are managed with the help of selective alpha blockers. Contraindicated in heart failure due to the mechanical obstructions. In that situation, aortic stenosis. If we are giving medication that can cause a vasodilation, but the mechanical obstructions, so that is very damaging. Okay. If the vasoconstriction due to some other problems, then okay, we can give vasodilatory medications. But if the mechanical obstructions are there and due to that the heart failure, in that situation we cannot dilate the blood vessels, otherwise that can cause severe problems. Okay, specific concentration, volume depletion. If the patient is already volume depleted and we are giving the medications like vasodilatory medications, that can significantly cause the orthostatic hypotension, and also the renal impairment is also associated within such kind of situations. In diuretics, beta blockers, calcium channel blockers, these kind of medications are also causing the hypotension, and along with that if we are giving the prazosin, that can significantly cause the first dose hypotension. Hepatic impairment is also problem. Surgery, the alpha blockers used to increase the risk of intraoperative floppy iris syndrome. Elderly patients often intolerance due to orthostatic hypotension. Okay, because the orthostatic hypotension are more common in elderly patients, because elderly patients are not giving a good response to change the positions and change the blood pressure. Pregnancy, it's okay if the patient is required, then we can give the medications. Breastfeeding is not very important at this point of time. But common side effects, orthostatic hypotension, nasal congestion due to vasodilation. This is also due to vasodilations. Urinary urgency is because of the bladder neck and the prostate relaxation. Dizziness, headache, fatigue and drowsiness is because of the blood pressure reduction. So these are the very common side effects and is a more kind of self-explanatory. Tachycardia is due to what? Tachycardia is due to reflection of the vasodilation. Some patient can give good, more responses towards the tachycardia, and they are getting such kind of side effects. Edematous condition, again, the vasodilation that can increase the fluid retention and edema. syncope, that's a blackout. This also the blood pressure related, blurred vision, incontinency, nasal, dry mouth. This kind of problem some patients can experience, but it's not a very common side effects. Okay, shortness of breath, and these are the very rare side effects, but you have to build your awareness about such kind of side effects. Comparative information, when we are comparing these three medications, the efficacy is equally effective. No first line for hypertension. Hypertension, we are not using this medication for first line hypertension because that can cause a severe hypotension and that increase the risk of heart failure. So these medications are nowadays mainly used for the BPH. Tamsulosin is a selective bladder and prostate receptors. That's why this medication is used for BPH, not for hypertension. Prazosin has a shorter duration of action. That's why the multiple doses are required. But tamsulosin and terazosin, they have a longer half-life and is given once daily only. Adverse effects are pretty much similar of the group side effects. Drowsiness and dizziness happen, gradually change your position. Otherwise, that can cause a syncope or hypotension. Take the first dose at the bedtime. This is very important because the patient is taking the first dose at the bedtime that minimize the chances of getting the postal hypotension. But the most important thing is if the patient required to get up at the night, so there are multiple factors. One is changing the position, second is the light is the issue, and third is the stability is the issue. Okay, so that increase the risk of fall. So we have to build awareness among the patients when they are taking this medication at the night time. These kind of questions mainly in your real life situation when the patient is coming with the prazosin prescription and the first time the patient is taking such kind of medications, you have to cover these points. Okay, and in oral examination also the examiner is asking the counter questions related to this point. So you also have to build your understanding in that key practice point. The first dose hypotension is common. That's why we have to start. Like for example, prazosin, there's a 2 to 3 times a day. Okay, so initially we can start with the one dose at the night time. Okay, and after 1 week we can add the 2 doses. So that is more practically applicable advice we can give. Start with the small bedtime dose. Titrate over 2 weeks. Gradually we can increase the dose. If on diuretics, withhold a few days before starting. Okay, why? Because the diuretics can cause severe hypotension and vasodilation can hold the more fluid and that significantly cause the hypotension. That's why we have to be very careful. Any other antihypertensive medications already patient is taking, and if they start with the prazosin or tamsulosin, such kind of selective alpha blockers that increase the hypotensive conditions. Okay. So this is again the very small concept that add value in your learning journey, in your learning process. And thank you very much for joining today's class and have a great time. See you in the next class. Thank you very much for today's class. Have a great time. Bye-bye. Take care.